Welcome back. Today is the 70th anniversary of the D-Day landings in Normandy, and we celebrate the contributions of all veterans in our nation, but we also can't ignore the issues plaguing Veterans Affairs medical centers throughout the country.
A recent report shows often deadly wait times at many of those facilities. I've been following one local vet's struggle to get treatment at a VA facility, and I also looked at how this controversy is actually helping him right now.
Al Elson has been a locksmith in the Coachella Valley for over 40 years. Once active, the Vietnam veteran is now mostly confined to his Palm Springs apartment.
I can't work right now. I haven't been able to work for 6 months.
The 63-year-old has heart problems, Graves' disease, and problems with his knees.
Digoxin is another heart medication.
His list of medications too long to list, and he says it's been a struggle to get treatment from the VA in Loma Linda.
For 12.5 years, they were wonderful. I had a fantastic doctor. 2.5 years ago, it changed, and it's been a battle ever since.
Elson says he's been waiting to get 2 leads put into his heart.
It is like open heart surgery. They're going to open my chest up and go in. I'm going to have tubes coming out of it. I need to be able to know what's going to happen in my life. And if I'm being treated like this, how many other vets are being treated like this?
An initial internal audit by the Department of Veterans Affairs found Elson is not alone. The audit found questionable scheduling practices regarding appointments. This was in response to reports of veterans dying while waiting to be seen at a VA medical center in Phoenix. As a result of the controversy, Veterans Affairs Secretary Eric Shinseki resigned. But Richard Finn says the problem is far from over. Finn is a chairman of the Veterans Committee for a Better Community in Desert Hot Springs. He's been trying to help Elson get treatment. They've even reached out to Congressman Raul Ruiz's office.
He could die. That's the reality of the situation.
Like Elson, Finn is a proud veteran. Finn served 2 tours in Iraq.
40 veterans have died in Phoenix, let alone. That's unacceptable. It's unacceptable. I think it's a travesty, and this hypocrisy must be exposed, and something has to be done. We take an oath to protect the innocent, and I think our leaders have forgotten their oaths.
But this controversy may be having a positive impact on Elson's situation. He says the VA in Loma Linda just called him to move up his surgery. A sailor who put his life on the line for our country, Elson is outraged he's had to go through all this to simply survive.
Like they put my life on hold. And it definitely affected my health, definitely affected my business and my well-being.
And I just talked to Al. He was able to get his surgery yesterday. He's recovering in the hospital right now. The VA Loma Linda healthcare system also sent me a statement. They say that in non-urgent cases, patients can normally get an appointment within 14 days. They also said they're participating in the nationwide Accelerating Care Initiative. They're systematically reviewing clinic capacity to maximize their ability to provide veterans medical appointments. They're even extending or flexing clinic hours on nights and weekends, providing overtime for providers. And they say they'll be reaching out to veterans to determine if they want to be seen sooner than they're scheduled.
Great report. Thanks, Gloria.
Thank you.
19 past the hour. Coming up next.
We have